Hello friends, amidst this COVID-19 pandemic and panic all over, this is Sukanya with me, just here to share a few thoughts about why we should be on a lockdown for 21 days. I'm just sharing my thoughts on this. Well, so social distancing, the biggest weapon that is being employed right now. What is social distancing basically? We are only trying to increase the distance between people so as to eliminate the chances of the spread of the illness. Now, why do we take this sort of precautions? It's very important because as long as we keep the numbers of people who fall sick in control, we will be able to provide them with the required necessary hospital care, medicine facilities. But if it so happens that we leave this number going out of control, it's highly likely that we will not be able to afford the hospital care, treatment, or the amenities, equipments, number of doctors, nurses. All of these resources will fall short. As we're talking about this, I would like to quote Dr. Devi Shetty, the founder of Narayana Healthcare. He says that according to a particular calculation, just in Karnataka, we may have around 80,000 cases of COVID-19. Now, considering this, he says that 15 to 20,000 people might need hospital care. 2,500 people might require ICU care, and 1,000 people might require ventilatory support for breathing. This is a case that will not just rise overnight, that will not just rise in a couple of days. It might take a month or two to surface. So given this thing, I would like to connect this to Italy. The same thing happened there. Whatever is being predicted, the same thing actually happened there. If you see that they were the hospitals were not enough, the hospital beds were not enough, so people started lining up outside the hospitals, on the streets, on the roads. They were there waiting for hours, days together. And that also added to the pandemic. However, I would like to tell that we talk about Italy, we know the situation Italy is right now in. Do we think that the government did not take enough precautions? They did. They might have been a little late, but yes, they did. They employed social distancing. Do you think the government healthcare is not competent enough? Do you think Italy could not have the right healthcare system support? They did have. Italy has one of the world's best healthcare. They stand number 2 in the world. Then what happened? The government could not ensure that the people were following things. People did not listen. That was a problem. I'm relating this back in India here. So we have this situation of a lockdown, and we are all in a situation where we are quite panicked, we are upset, we are scared, we're not really sure of what's happening around us. But this is very important to us. It's a very crucial weapon that we're taking in our hands right now. I'll tell you an instance of Italy again. Lombardy is a place where the pandemic actually started off. In Italy, it's one of those provinces which was hugely infected. So what happened? The Western government, a very bold decision taken. What they did was around the first week of March, they tried to lock down this particular province, Lombardy. The media had leaked the news the previous evening, the previous night. You see a lot of people leaving the places, flooding, fleeing outside, going off the streets just to ensure that they go back to their own places, they stay with their family, and they wanted to just leave the place because they knew the lockdown was going to be in place in a couple of provinces. What happened? 20,000 cases were filed because they were going against the directives. So what happens here? Now, the similar case, what happened? Just after a couple of days, like around 10 plus days, you see there was a huge spurge in the number of people who were infected. In 2 weeks, we saw 300 becoming 10,000 in Italy. This is similar to the situation we are in India right now. It's a very important thing that we have to focus. It's very important that we have to give attention to right now. Social distancing is very important. The reason being, the moment the lockdowns were announced, we were all panicked, we were all upset. We were not very happy about certain things. However, a couple of us abided by it. A couple of us flew to different places. We wanted to travel, be with our family. I understand. In a time of crisis like this, we all want to be with our families. However, there has to be a lot of responsibilities employed. I was shocked to see the huge crowds, gatherings in Pune railway station, in Mumbai stations and bus stations, in Coimbatore in Chennai, and a lot of other places, because people wanted to reach to their natives. It's good, it's understandable, but what happens here? Similarly, when the numbers rose in Italy, When they traced back, most of the people who fled from Italy were the ones, fled from Lombardy were the ones who had actually increased the spread. Their own relatives, friends, neighbors were all infected. This could be the case here. Imagine there were like just 2 people in that Chennai, Coimbatore that night of lockdown. There were 2 people, and then 2 transferred to like 10 of them traveling with another 10 of them. And you cannot understand the proximity of how much it could have reached to. And this will not come out now. It will only come out a couple of days or weeks later. So the point here is we all need to employ social distancing. This is not to panic you. This is not to put you in a state of overwhelming, mindset. This is to help us understand that we need to stay positive. We need to stay very, very prepared and precautionary. We have to be conscious about what we are doing, and we need to stay safe indoors. Stay home. Just going back, I'm doing this video here on 27th of March 2020. According to the rates now, the world has around 538,000 people who've been affected, whereas Italy has 85,000, and US is just crossing Italy's mark. Just today you see 85,000 plus cases in US as well, with 1,200 deaths just in US. And India stands at a mark of 750 today. This surge has just happened in the last 1 week, last 4-5 days in precise. And this is the period, this is a stage where the growth is going to be exponential. And it's very important for us to act wise. I urge all of you to stay home, stay safe. It might be boring, but you can make it interesting. Life is more important. Please value yourself, your family, the society, the country, and the world. Stay home. Thank you.